Hello and Assalamu alaikum. This is Ultrascan Diagnostic, and this is the patient which has been referred to us with the area of interest highlighted is the upper left first molar. The upper left first molar on the 3D rendering shows that there is periapical radiolucencies and buccal cortical plate perforations. It seems to have a crown cutting done, so probably had a crown restoration on top of it. Now moving to the sagittal view. This is the sagittal view of the patient. I'm going to slightly zoom in for our kind doctors. We're looking at this tooth at 150 micrometers. Now at 150 micrometers, we can clearly see that at the sagittal section, there is a radiolucency present intraradically, and that is of concern because there is a crack that is clearly visible right here, which is associated with this radiolucency. Now, this is the mesiobuccal root. This is the testobuccal root, but here we can see that right in the middle, there is a crack propagating between the intraradicular area, also associated with this radiolucency. Now, from a coronal view, this is the coronal view, we can clearly see the radiolucency is quite significant, whereas the crack is propagating from here into the intraradicular bony spaces. So this tooth is definitely cracked, and the crack seems to be in an area which will be difficult to repair. This tooth is not associated with any sinusitis at the moment, but we can see that the radiolucencies is affecting the sinus floor and can also lead to infections in the sinus. On the axial view, we can clearly see that this tooth does show a crack in the intraradicular area right here, and this, ladies and gentlemen, is the reason why this tooth seems to be cracked right there. And we also see that that's where the crack is. We can also see a crack in the root structure as we move apically on the mesial aspect, and that's right there. So that's also another problem with this tooth. The palatal bone also shows but cortical plate perforations. If we move to this section, so here we can see that the palatal root is also associated. It is causing inflammation in the sinus. It is also perforated on the palatal aspect, and a sinus probably is visible intraorally clinically as well. So if you have any further questions regarding this case, please feel free to reach to our team, and we would be very happy to help. So this is the parietal root, and you can see the parietal root is associated with cortical perforations and a periapical radiolucency as well. Thank you very much.